Lee Zinkan-McKee is a registered nurse with the Georgian Bay Family Health Team Healthy Aging Program and joins me today to talk about bone health. Welcome.
Thank you.
So to start, what is the Georgian Bay Family Health Team?
The Georgian Bay Family Health Team is a primary healthcare organization. We have over 50 physicians associated with our organization, and then a team of other healthcare professionals involved. So we have nurse practitioners, registered nurses, occupational therapists, social workers, mental health counselors, diabetes educators, and so we provide primary care programming supports to patients who have a physician that are rostered with the Georgian Bay Family Health Team.
And how does the Healthy Aging Service work?
So we are actually called the South Georgian Bay Healthy Aging Program because we're broader than the Family Health Team. It's a community collaboration between the Georgian Bay Family Health Team, the South Georgian Bay Ontario Health Team, and the North Simcoe Muskoka Specialized Geriatric Service, and that's a regional service. So we work together to support older adults living with frailty and their caregivers or significant others to live independently and safely at home.
And it's an interdisciplinary team, you mentioned. So how do all the different healthcare providers work together to support adults that are aging?
Great question. So what we have is, on our team we have registered nurses, occupational therapist, and a physiotherapist. And everyone is skilled and trained in basic, what we call geriatric assessments or comprehensive geriatric assessments. So any one of the clinicians on the team can be involved in those assessments. And then the various team members bring in their area of expertise. So if we're supporting a patient that has a certain area of concern, then we can pull in that person that maybe has that additional level of expertise.
And what's involved in the assessment? Just briefly.
Certainly. We actually offer two levels of assessment. So the first one is what we call a general geriatric assessment. This is specifically for patients who have a physician rostered with the family health team. And this is often a more targeted assessment. So maybe a person comes in with a concern about their memory or about mobility. Then we do a very targeted assessment. But then our partnership with the Specialized Geriatric Service supports us in providing comprehensive assessments. So these are appointments that are around 2 hours long, and they assess multiple systems of the body and how a person is functioning from day to day. And then after that completed assessment, then we can look at possible causes of the challenges the person's having, perhaps treatment strategies or support strategies. Then we provide health teaching around that and can make referrals to specialist or community resources as we need to.
And what specific programs and supports are available to support bone health, particularly for people with reduced mobility?
So again, it starts with that assessment. So the first thing we're going to be doing is that assessment, determining how targeted or comprehensive it needs to be. So for instance, a person experiencing problems with mobility, we're going to start with looking at their musculoskeletal system. So are they having trouble with balance? Is their gait off? Are they having trouble with strength? Some of those kind of things. Then we're going to be looking at things like vision and hearing, because that all has an effect on people's balance and mobility. We're going to be looking at things like footwear. Is the person aware of proper footwear to be doing? Talking about their environment. So what possible changes do they need to make in their environment to help them with their mobility, or most importantly, avoid a fall. Then we're also going to be doing health teaching. So again, going back to mobility, we would be talking about things like physical activity, nutrition, doing a review of medications and talking about medications that might be impacting. Again, looking at the environment and talking about falls prevention and strategies to prevent someone falling and possibly getting a fracture.
This is kind of an obvious question, but what's the connection or what's the importance of falls prevention and bone health for older adults?
Excellent. So very often, a person, for instance, if they're starting to or they're developing osteoporosis or brittle bones, there's not necessarily any symptoms that show up, signs or symptoms. So the person may not be diagnosed with it until they actually have had a fall. And once a person has a fall and a fracture, you have complications that can develop. There's a recovery period. It increases a person's vulnerability to another fall. So it's important that we do things that enhance our bone health and prevent a fall from happening.
If people are concerned about their bone health, what do you suggest?
So the three key messages I would say are physical activity, proper nutrition, and falls prevention. And if you like, I can go into a little bit more detail. So in terms of physical activity, the recommendations are 150 minutes of a moderate level exercise per week. And by moderate, we mean enough to get your heartbeat going, your heart rate raised, so you can talk through the activity, but you can't necessarily sing through the activity. Those minutes can be broken up into 10 minutes segments. So a person maybe can do some 30-minute sessions, but if they're not able to do that, if their mobility is decreased as such as that's too difficult, even doing it in 10-minute increments is equally valuable. We also talk about the importance of strength and balance exercises, and we recommend those 2 times a week, and that's to help with strengthening and balancing exercises. And what the evidence is showing, especially if people have reduced mobility, even a small amount of activity shows benefits. So, do what you can within your capabilities, that's of benefit. The second message is proper nutrition. And our recommendations follow the Canada's food guide, so eating from all the 4 food groups. When a person is aging, and in terms of bone health, what's particularly important is adequate amounts of vitamin C, vitamin D, and protein, and getting those through food. So that's really important. And the last is, again, talking about falls prevention. So what strategies can you do to prevent falls from happening? First and foremost, looking at your environment. So perhaps decluttering your house. Is lighting adequate in the house? Is there furniture in the way? So really looking critically at your environment. Is there good sticky runners or good footing going up and down stairs? Do you need rails? The other thing would be looking at footwear. So, having footwear with good soles on it, fit your feet firmly, and having good footwear for both inside and outside. Sometimes we have good footwear outside, but put on slippers inside that aren't so good.
Yeah, I shouldn't call them out, but I've talked with my dad about that. Okay, thank you, Lee. How can people learn more about the Georgian Bay Healthy Aging Program?
So they can go to our website, gbfht.ca. There's also the specialized geriatric services I mentioned, nsmsgs.ca. And if I could mention 2 other websites, and that's for really detailed information about physical activity, healthy eating, and falls prevention, is Osteoporosis Canada or the Arthritis Society are both excellent sources.
Wonderful. Thank you very much. Thanks for joining us.
Thank you.